Hello, Dental A Team listeners. We are so excited to be here with you today. I have my gal Dana on the cast with me today, and I am just so excited. Dana, how are you today? How are you enjoying this heat that we've got coming through? I know up here in Phoenix it's hot. Down there by you, it's got to be warm too, but how are you?
Doing pretty good. I am actually enjoying this weather. I was out a lot this weekend for sports. I have some wacky tan lines, but I am loving the sunshine and the extra warm weather we've got.
I love it. I keep getting the bottom of my legging to my sneaker. I got a nice tan right there on my leg, and I think it's the only spot on my legs at all that even knows how to tan anymore. So I feel you. I
Yeah.
feel you. Today we have a really fun one, docs and teams that are listening. And today is just all about relationship building. I really wanted to pick your brain today, Dana, and really see what you're doing with a lot of your practices, what you've done in practice, and very specifically, maybe even like our pediatric practices that we have. What are we doing to keep the relationships with our patients, to keep the patient? So, how are we investing in those relationships from a doctor's standpoint and really from a team member standpoint as well? I know a lot of my doctors out there, we definitely focus in really heavily on the team side. What can the team be doing? How can the team build the relationships? And that is super important. But I want to stress the fact that this is for you guys today too. It's very important also that you're building those relationships and that you're showing your team the kind of relationships that you want to have built so that they know what the heck you're looking for. So, Dana, I'm excited for this one. I know we've got quite a few pediatric practices between the two of us, and Christy's got some pediatric practices as well. So, that's a space that I think is really fun in the relationship building area. And it does translate to GP, to oral surgery, all those pieces as well. So if you guys are not pediatric and you're listening, don't fret. This is for you too. But I thought it would be fun actually to pull in some of that pediatric side because it's just so cool, in my opinion, what they do, right? First of all, that they are just serving so many amazing little humans and creating an experience that these patients are forever going to love the dentist, which I think is amazing. But also, they've got their hands kind of tied, especially when it comes to this relationship piece, because they are building a relationship with the patient, but their focus really is making sure that the parents are happy, that the parents understand what the services are being rendered, what kind of why it's different, why their kids are getting such excellent treatment. So, Dana, how are you right now? You've got, I know, one pediatric practice in general I'm thinking of. You've got quite a few, but one pediatric dentist in particular right now is really working on the new patient acquisition side, and a lot of that comes down to this patient relationship piece. So, what do you suggest for your pediatric practices and really your general practices to really get that going and get that spearheaded for those?
Yeah. I love this part of dentistry. I think it's something that is like unique to dentistry as far as healthcare, because we tend to see these patients multiple times for years and years. And so it's a unique space for dentistry, and it's something that I think is so fun. And you're right, with pediatric, I think that it's twofold, right? They've got the kiddo and they've got the parent. And because pediatric relies on volume of patients, they've got to build relationships really, really quickly too, right? Because
Yeah,
they are churning and cranking
they are.
through patients and parents all day long. And the first thing that I always say to any pediatric practice is you have to build the trust to be able to build the relationship. So as much as you can focus on the comfort pieces, the show, tell, do, the walk them through everything. I love a pediatric practice that will pull the parent over and, hey, let me show you, right? Like, yes, we want to talk about flossing technique. Let me actually show you as I do it to your kiddo. Let me show you that spot that I'm talking about. Let me take a picture. Let me walk you through it. And as I'm taking the picture, letting the kiddo know exactly what they're going to do each step of the way starts at when visuals, we can't really deny the things that we can see with our own eyes, right? And trust and comfort when we know everything that is going to come next and what it's going to feel like and what it's going to look like and how we're going to navigate that together. I think that pediatric practices, like creating that space, is something that's truly magical and that a lot of general dentists can learn from, because no matter what practice you're in, you're going to have patients who are nervous, who are uncomfortable, who have anxiety. And I think kiddos, like top the charts by 10, right? Because they're also little humans who are learning to manage those emotions too.
Yeah.
And so if you can take any of those pieces that pediatric practices do really well and incorporate it into your general practice, but just that foundation of trust and comfort will go a long way in building any sort of relationship, whether it's with the patient themselves, the kiddo, or a parent.
Yeah, I think that's brilliant. And it translates so well to continuing that relationship as they age. So building those relationships for the kiddos. And I loved the see, show, tell, do, right? All those pieces of like, this is what even just this is what we're doing today. Let me show you. Let me teach you how to do this at home. Let me show you all of these pieces. It's the same thing when we become adults, right? We should be translating those similar practices in building those relationships, but really building a firm foundation of comfort for our patients. And part of that comfort level is really the amount of conversation we're willing to have with the patient. Sitting in silence, sitting there with a dental assistant or with a hygienist that's just like, I'm uncomfortable. I don't know what to say. It's awkward. So if they're not the ones initiating and creating the relationship, or the doctor's coming in and just going straight to work, not like opening it up, not being introduced to the room, not having those spaces where communication is really abundant, can really hold a patient back from being open. And that openness, that vulnerability is what builds the relationship. So I think just as you do with your pediatric practices, and then really taking a step back and reviewing the whole appointment, reviewing all of the information with the parent, we should be doing that in a GP older adult practice as well for adolescents and adult patients, and really sitting them down and covering, what are we doing today? What questions do you have? Like, let's really thoroughly go through this and make sure that you're comfortable before we start. So I think that's brilliant. I think it's awesome that we start at the pediatric ground level, and really make the parents comfortable too. And then for the GP practices, for my adult practices, if they're getting this kind of care for their child at the pediatric dentist, they're going to change some expectations, in my opinion, for what they should be receiving as well at their own practice. So really ramping those spaces up is going to be critical. And communication is the center focus of it all. So with oral surgery practices, endo practices, perio practices, GP practices, and even pediatric practices, you guys, where does that start? Like, consider, where does the communication start? And I know I had a call with a doctor the other day that was like, gosh, my front team just still will not put in the notes on my limited emergency exams, and it's driving them a little crazy. And it makes me think right there, right? That's an opportunity. It's a very easy opportunity to enhance and increase a relationship with the person just by letting them know we paid attention, just by caring enough to have that information already ready to go. So if you're taking an emergency call, really documenting what it is that we chatted about, or a call for a filling that's high, or anything at all that's out of the ordinary on treatment that was recommended. A patient might say, I don't know, a patient might even call and say, hey, I had a crown that was diagnosed that I never scheduled, and now I'm in pain. Well, that needs to be documented. Schedule the crown, document the pain, because when that patient comes in, we can really pour the love and the care and the attention into the situation rather than finding out firsthand. And the patients love that because they feel seen, they feel heard, and they feel valued. And Dana, from your experience, even in office and working with practices, where else are you seeing some spaces that practices can really increase, or even just like capitalize on what they might already be doing to really build those relationships so that patients keep coming back and they refer other amazing people to our practices?
Yeah, I've been coaching a lot of practices. One thing is new patient paperwork, right? We've asked
Yeah.
a lot of questions on that new patient paperwork, and we ask them because it's valuable information. And so, getting practices to build in part of their exam protocol and their prep for patient protocols, we actually look at the answers and we notate them somewhere so that we remember to discuss them. I've got a lot of practices that are incorporating smile raters to try to, open ortho discussions, and those are great, absolutely. But we have to engage in it. It's not enough just to ask it on a piece of paper. We have to actively look at it, plan, prep, and then actually bring it up and discuss it with the patient. So I think new patient paperwork is a space where a lot of practices have best intentions of getting that information and making it super personal. We just have to make sure that we're looking at it and we're translating it and we're talking about it in the exam for the patient to understand how that information corresponds to their care in your office. Same thing with new patient phone call. Just like you gave an example of that limited saying that, hey, I was scheduled for that crown and now I'm in pain, right? And notating the pain. Same thing on the phone call. The questions that you ask, make sure we get that information to the team, and the team is prepped and ready so that they can dive in a little bit deeper with the patient and have the patient feel like, hey man, they asked me those questions on the phone. They heard my answers. The team was prepped and ready for it. And we jumped right in with my main concerns, with the things that I'm here for, even if it is just establishing care, right? Making sure that we are reinforcing that we know that that's why you're here, because we took the time to get the information. So a lot of times we take the time to get all the information. We just don't actually utilize it with the patient.
For sure. And I think that's a great action item, you guys, is really take that back to your teams of anywhere where we are gathering information, making sure that it's put in the appropriate space, and you guys, that there's consistency in where that space is so that everybody knows where to find it, everybody knows where to put it, but having that conversation with them of making sure that that information is put in that space and it's relayed to the next person. Huge, huge, huge caveat here. If we're putting the notes in, the biggest, easiest way to deter a front office team from putting phone call notes in the appointment is for you to not use them. So if you're going to ask for it, make sure you're using it. I don't know how many times when I was up front, somebody would come and they'd say, hey, Tiff, is this patient on any medications? Are they taking Tylenol or anything? Like, I'm about to go get them. Like, what's the stitch here? What's the scoop? And I would look at them and be like, did you read the notes? I'm happy to have a conversation with you if we have to. Like, I'm totally fine if you need clarifications, but I'm not going to double dip. So I'm either going to put the notes in or I'm going to talk to you every single time. I'm not going to double dip because I am not a person that will work harder than she has to. So I'm not going to duplicate my efforts. I'm just going to do the path of least resistance and whatever is going to be the most efficient. And if the notes aren't being used, for me, that's an inefficiency. I'm working for nothing. And so I'm going to reduce and remove the inefficiency and go with whatever the rest of the team is going to accept. So I would stop making the notes and then they'd get frustrated. So you just have to stick with it, front office teams. Remind them, refer them back to the notes. They've got to get used to it. And back office teams and docs, just make sure you're utilizing those notes in the best ways you possibly can. On the notes of really building the relationship, I want to remind everyone that our words truly matter. The words that we use, the way in which we use them, make a difference because the person you're talking to is interpreting those words and they're going to interpret them however they see fit in that moment. So if we're not very careful with our words, we could turn a situation into something totally different. And it doesn't mean it could be catastrophic, but it doesn't mean it's going to be catastrophic every time. It just literally changes the tone in slight variances dependent on what you're doing. And I have to tell you this story, Dana, and everyone listening. I have to tell you the story. Aaron and I were out on Saturday. We went to our favorite little golf club, restaurant, and he had just passed this really, really hard, crucial, studied for a year test, and we were celebrating him, and I was just so excited. And we decided to sit at the bar because we did not make a reservation, and it was wild in there. But regardless, we're sitting there, so I can hear other conversations going on. And the couple next to me, they wanted they wanted a recommendation on wine. And they asked the bartender who came over, hey, which one do you think we should get? And the bartender, like, it wasn't wrong, but immediately my brain was like, oh my gosh, I can fix this for you. It wasn't wrong. But the bartender said, oh, well, I don't really drink wine, but I can tell you which ones are, most asked for, which ones are the most popular. And in my brain, I thought, you just planted doubt in their minds on your recommendation because you told them an unnecessary statement. They didn't ask, which wine would you drink? They asked, which wine do you recommend? You planted a seed of doubt in the recommendation by saying that you don't drink wine. So the first statement was a negative. It was a defense to defend. If you don't like the wine, it's not my fault because I don't drink wine. I know nothing about it. But let me give you a recommendation anyway. So he planted the seed of doubt in this couple's mind instead of just saying, oh, yeah, for sure. Let's take a look. So I can tell you what our most popular wines are, what most people drink here at the restaurant. And if their follow up was, well, what about you personally? Fine. But the statement out the gates was, I don't drink wine, but I can tell you. And I thought, I looked at Aaron because my brain cannot ignore it. And I looked at Aaron and I was like, why is it so hard? It's not, that was unnecessary. So, my point in that is we sometimes say things that are just unnecessary statements to fill space. And that space filler, just like corn and everything that we eat, is unnecessary and it's harmful, right? We have all these foods with all these fillers that are harmful, but it makes it look better, right? So you fill the void and you fill the statement with something that makes you feel better about how the outcome is going to happen. And what it can do is it can hurt the conversation. So I want everyone to really like let that sink in and think about how what you say, the words that you use, and the way in which we state them really make a difference. And think about, I don't really drink wine, but what I can do is tell you what our most populars are compared to, oh my gosh, yeah, absolutely. Let me tell you what our most popular wines are, the ones that people are really loving right now. It's a totally different situation because of trust. You lose trust when you start on a negative. So if a patient says, I'm off on Fridays, you had said, what day of the week works best for you? Knowing you were only open Monday through Thursday. You said, what day of the week? Your patient says, oh, I'm off on Fridays. That would be fantastic. And you're like, oh gosh, well, we're not open on Fridays. Is there another day? Well, now you just told me no. And I'm like, well, it's my day off. So now I'm in a different state and a different mood than I would have been if you had said, we're open Monday through Friday. Which day in that portion of the week would work best for you? Now I know that's all I have to work with. And it just like, Dana, that conversation, overhearing the conversation, like, I can't get it out of my head. This was days ago and it's still in my head. Like, I just want to help this man sell more wine. Like, he would sell so much more wine if he just changed the sentence slightly. He's not lying. He's not changing anything except removing the seed of doubt because the recommendations are going to be the same either way. And it's just been driving me crazy, Dana, driving me crazy. And these are spaces I know that you see in the practice too. So there's, the one hand of scheduling, but where else do you see it? Like treatment planning, billing, like where else are you
Oh
seeing
yeah,
that?
I see it in treatment planning all the time where we want to fill the space with we automatically jump to there's financial concerns and truly it could just be that the patient's thinking about their work schedule and when they can find an hour of their
Yeah.
time, right? So it happens in treatment planning all the time. It happens when we're bringing on a new doctor, right? It's a scheduling thing, but it's like, oh well, are you willing to see this doctor or do you want your doctor you always see? Well, you just like they probably would have had zero
Yeah.
hesitation. They said they loved their appointment. They didn't complain at all about the new doctor that they saw, but you just planted that seed in their mind that it should be something that they should consider or be upset about.
Yeah.
And so we do it all the time in dentistry. And I love that you pointed that out and like truly be careful of those things and watch your words because again, that is part of relationship building, right?
Mm-hmm.
If I make you feel like everything that you went through today was successful, right?
Yeah.
And that you won your visit, you got the doctor that you love, you all those things. And then I plant that little bit of a seed, right? It's like you just chopped that relationship down
Yeah.
and you gave them something to be upset about or concerned about. And so I love that you pointed that out because I don't think we often connect like our words with that relationship building, but it truly can impact an experience with something so simple like that.
I totally agree. I totally agree. Erin tells me constantly, babe, you're such a great communicator. I'm like, Agree. I have taken a lot of communication courses. I can agree. I can figure out some dang good communication, but mostly I'm choosing my words really wisely and I'm manipulating how I form my sentence to get the results that I'm after. And the result that I want is that we stay in good communication, that we both stay in a positive state, even if one of us can't give the other what you wanted or it looks a little different. Like
Mhm.
I'm here to ensure that the words that I use and the way that I structure my sentence and my statement doesn't put any negative feelings on you. So my best result is that we both walk away still happy, even if we didn't get what we thought we wanted. That's the result I'm after. I'm not here to talk anybody into anything they didn't want. Never. I could use my words to do just that, but my result is we're both leaving happy no matter what the situation actually turned into because we communicated so well through it. I might be telling you that I can't give you exactly what you asked for, but I'm going to find a solution around it to get as close as I can so that you still feel taken care of. And that's why communication to me is so important and why the structure and of the sentences of the statements and the words combined can make such a drastic difference. I don't know how many times I've heard people on the phone, no, actually, we don't take that insurance. We bill to them on your behalf, but we don't actually work with them. Like, I'm like, oh my gosh, just say, goodness gracious, we have so many patients that come with that insurance. We know exactly how to work with them while we're out of network. Like, we still obtain and receive as much of your benefits as we possibly can. And we work really hard on your behalf to ensure that you're happy. I don't know, say anything else, say anything under
Yeah.
the sun different than what just came out. Like just practice getting the results that you want and let that result be that no matter what, we both walk away still happy.
Mhm.
Dana, this was fun. I love talking communication. I love relationships. I love diving in on it. And I think I'm going to let you wrap us up. Wrap us up on some, I know, I haven't shocked you with anything lately. So there you go. No, wrap us up with some like quick action items that you think. I let you mostly talk about or asked you to talk about the pedo stuff and all of that. So what are some action items that our doctors and our teams can take away from today and really push forward with?
Yeah, I think biggest thing is build trust, focus on relationship building. I love that you said watch your words, make sure we're focusing on how we can win with the patient versus putting roadblocks in front of them. And the biggest thing as far as structure and systems is notes. Where are we
Yeah,
putting the things that we find out about patients? How are we reviewing the intake of their paperwork or the phone call information that we get from them? And then where are we using that in our exam flow?
love it. Beautiful. Thank you. Okay, you guys heard it from Dana. You heard it right here. Thank you so much, Dana, for being here with me today. You know I'm going to pull you in for some more, so y'all will be hearing her voice in no time at all. Thank you, everyone, for being here, for being constant. Just superheroes for us in this world and sharing us with everyone you know. We truly appreciate that. We are always looking to help and reach as many people in the dental community as we possibly can. So share this podcast with a friend. If you're a current client, thank you so much. Share us with all your friends. If you're a soon to be client, we cannot wait to meet you. And for those listeners who are just on the fence and out there wondering, keep listening. We're here. We're always going to come back, and we are always here when you're ready for us. So for now, we'll catch you guys later.